Group 7, COVID-19 Beliefs and Practices. As we attempt to analyze whether an association or relationship between the beliefs and practices of college students at OSU and COVID 19 exists, through our strategically generated cross sectional survey, in addition to whether the data obtained through the survey illustrates these beliefs and practices are in relation to many individuals' demographics, such as age, race, and college rank, including many others, which we will further explore in this here presentation. Hello, I am Hunter Austin of Group 7, and I'm here to present to you the information from the background and conclusion of our survey. The topic we had was beliefs and practices related to COVID 19, both on and around campus. The beliefs included: do you believe that COVID 19 poses a significant risk to your health? While practices included: how often do you wear a mask in public where social distancing is difficult to maintain in a typical week? 2. How often do you follow the recommended social distancing guidelines outlined by the CDC in a typical week? 3. How many times in a week are you attending in person social events on average? And finally, 4. Have you been tested for COVID 19 this semester? If so, how often? Our research questions include: 1. Do students who visit campus have a greater concern about contracting COVID 19 than those who do not? 2. Is there an association between a student's household size and the number of times that a student has contracted or been infected by COVID 19? And 3. Is there an association between a student's college rank and their belief in public health practices such as social distancing, masking, and hand washing with soap and water, and if these practices would prevent the spread of COVID 19? Our survey's demographic questions included age, race, sex, college rank, how many people are in your household, including yourself, which of the following best describes your current living situation, are you currently taking in-person classes, those including hybrid classes here at OSU, and lastly, how many times per week are you on campus?
Hello, my name is Rudra Dungana. I am one of the team members from Group 7. I'll be presenting on methods for our survey. Our data came from OSU undergraduate students who responded to our online survey questions on Qualtrics. Our survey was based on beliefs and practices related to COVID-19 on and around the campus. It was a cross-sectional, self-reported survey. Students who answered our survey questions are currently taking in-person, including hybrid and online classes on Columbus campus. We took demographic factors such as age, sex, college rank, and residential status into consideration when we distributed our online survey. Therefore, the data that we collected from our sample is a representativeness of OSU undergraduate students regardless of their majors. We created the convenience survey targeted to OSU undergraduate students aged 17 years and older to determine if students who live on campus have same belief on how COVID-19 spreads than students who live off campus. Our survey consisted 16 questions and included multiple choice, binary, and open-ended questions. Our 4 questions were for demographic data. Respondents were asked to identify their class ranks, age, sex, and if they were exposed to COVID-19 before. 1 open-ended and rest of the closed-ended questions were asked to evaluate students' behaviors such as social distancing, masking, hand washing towards COVID-19 prevention. We shared a URL survey link that was generated from an online survey Qualtrics via email and Carmen messaging to on and off campus OSU undergraduate students of various class ranks. We thought This was a better option available considering the time and COVID-19 situation. 109 people responded to our survey questions and they sent their answers. This was a better representative sample of our targeted population. We gave them the 15 days to answer our survey questions, and finally we closed our survey. We used descriptive statistics to summarize our means, standard deviations, and proportions. We used a standard cut point of alpha equals 0.05 for our statistical significance. We also used 95% confidence interval to calculate the sample means. Most of our survey data were categorical with more than 2 categories. Therefore, we used chi-square test to perform our hypothesis testing. Some of our variables, though, were continuous, such as age, household size, how often respondents did their COVID test, and how many times they were on campus in a typical week. We used the software R and RStudio to calculate our statistical data. Categories without much data were combined as others. We used the software R and RStudio to calculate our statistical data. Categories without much data were combined as others.
Hi, I'm Tiffany Bonner, and I'll be reviewing results of all 4 of our research questions. For research question number 1, do students who visit campus in a typical week have a greater concern about contracting COVID-19 than those who do not? We performed a t-test with a 95% confidence interval of approximately between 1.99 and 8.90 with a sample mean of 5.44. Comparing contraction risk mean of 2.67 with a standard deviation of 1.62 and an on-campus mean of 2.92 and a standard deviation of 2.27. We had an output of a p-value of 0.002897, which is less than our standard cut point of 0.05. Comparing our 2 population means, population 1 mean for students who visit campus, population mean for students who do not visit campus as our population mean 2. Our null hypothesis would be that population mean of group 1 is equal to that of group 2, and our alternative hypothesis would be that they are not equal to one another. In comparing statistics, approximately 51 respondents claimed that they were not on campus at all during the week, whereas 53.21% or 58 respondents responded as being on campus anywhere between 1 to 5 plus times a week. Research question number 2. Is there an association between a student's household size and the number of times that a student has contracted or been infected by COVID-19? A Pearson's chi-squared test was performed, comparing household size with positive COVID tests, and a p-value of 0.000000008425, which is less than our standard cut point of 0.05 significance level, was received after performing the chi-squared test. Research question number 3. Is there an association between a student's college rank and their belief in public health practices such as social distancing, masking, and hand washing with soap and water, and if it would prevent the spread of COVID-19? Here again, a Pearson's chi-squared test was performed to test for association between college rank and public health practices. Out of 109 respondents, 85 or 77.98% reported practicing public health guided measures daily, with freshmen reporting the highest percentage, 24.77% of daily practice. A p-value of 0.000000411 was received. Research question 4. Is there an association between how often someone wears a mask and their sex? A Fisher's exact test to test for association was performed. The majority of respondents, 91.74%, reported wearing their masks daily, with 66 females, approximately 60.55%, and 32 males, approximately 29.36%. And 2 categorized as other, approximately 1.83% responded. Comparing frequency of wearing masks, days per week compared to the sex, female, male, or other, a p-value of 0.000004121 was received, significantly lower than our cut point of 0.05 level of significance.
Results and conclusions for research question number 1, days on campus per week. Null hypothesis. True mean equals 0. Alternative hypothesis. True mean does not equal 0. With a p-value of 0.002897, which is less than the significant value of 0.05. What do these results mean? Contraction risk for students who do not visit campus is 2.666667, and for students who visit campus, their contraction risk is 2.92381. Results leading to the conclusion that a statistically significant difference with a p-value of 0.002897 indicates a difference in contraction rates between those who visit campus and those who do not. The results and conclusion for research question number 2, household size. Null hypothesis. No association exists between a student's household size and the number of times that a student has contracted or been infected by COVID-19. Alternative hypothesis. An association exists between a student's household size and the number of times that a student has contracted or been infected by COVID-19, with a p-value far less than the significant value of 0.05. What do these results mean? We assumed there was no association between an individual's household size and the number of times contracting or having been infected with COVID-19. While based on the presented results, there is evidence we would reject the null hypothesis and conclude an association between household size and the number of times individuals attending OSU contracted or were infected by COVID-19. Results and conclusions for research question number 3, the following of public health practices. Null hypothesis. No association exists between a student's college rank and their beliefs in public health practices, such as social distancing, masking, and hand washing with both soap and water as preventative measures regarding the spread of COVID-19. Alternative hypothesis. An association exists between a student's college rank and their beliefs in public health practices, such as social distancing, masking, and hand washing with soap and water as preventative measures regarding the spread of COVID-19, with a p-value far less than the significant value of 0.05. What do these results mean? We assumed no association would be present between an individual's college rank and their beliefs in public health practices. While our results indicate through statistical evidence we can reject our null hypothesis and conclude an association does in fact exist between an individual's college rank here at OSU and their beliefs in public health practices such as social distancing, masking, and hand washing with soap and water as preventative measures regarding the spread of COVID-19. The results and conclusions for research question number 4, frequency of wearing a face mask, days per week. Null hypothesis. No association exists between how often someone wears a mask and their sex. Alternative hypothesis. An association exists between how often someone wears a mask and their sex, with a p-value of 0.000004121, which is less than the cut point value of 0.05. What do these results mean? With the prior assumption that no association would exist between how often someone wears a mask and their sex, with a new p-value less than the significant cut point of 0.05, we can conclude with the rejection of our initial null hypothesis, concluding An association is present between how often individuals wear face masks and their sex.